Good day, everyone. I am Maria Cecilia Licuan, and I am here to present to you my research paper entitled Design, Development, and Implementation of the Pediatric Physical Therapy Senior Clinical Internship Telerehabilitation Program of De La Salle Medical and Health Sciences Institute, The Pandemic in Fetus. This presentation is divided into 5 parts. Part 1 will talk about the background. Second is the objectives. Third is the methodology. Fourth is the findings. And fifth is the conclusion, which eventually presents the actual design, how it is developed, and how it is implemented as far as the Pediatric Senior Clinical Internship Program of DLS-MHSI is concerned. We are currently facing the greatest challenge the world has ever faced. This is the pandemic brought about by COVID-19. It started way back in early 2020. Around March, the Philippines was already called for a lockdown. Because of this, a lot of institutions, including academic institutions, were put on hold based on the limitations posted as far as quarantine restrictions are concerned. Because of this, the way that we deliver the educational programs were affected. That includes the clinical internship program. In physical therapy, clinical internship would mean actual on-site, face-to-face interaction with different kinds of patients. That includes the pediatric population. Given the challenges posed by pandemic, the extent by which the exposure of the interns are concerned were put on hold. And because of this, academic institutions like De La Salle Medical and Health Sciences Institute were challenged to think of solutions that would still comply with the standards given the Commission on Higher Education program outcome. Because of the pandemic, the La Salle Medical and Health Sciences Institute College of Rehabilitation Sciences Physical Therapy Department started to think of possible ways by which the internship program will still be able to continue on, which during that time would start by August of 2020. Given the declaration of the quarantine restrictions that started on March 2020, it only gave the department few months, that is April, May, June, and July, to plan what to do as far as the internship is concerned. The planning was faced with difficulty. This is because the practice of the virtual internship program, which provides the solution given the restrictions in terms of face-to-face interactions during that time, was not fully established as a practice in the Philippines. In fact, it is very hard to find any existing institution during that time that actually practice telerehabilitation. Given this, there is a great challenge to overcome as far as the initiation of a telerehabilitation program is concerned. Given the challenges posed by all of the restrictions related to quarantine protocols, this study presents itself with the general objective of determining what pediatric physical therapy senior clinical internship program can be utilized by the institution, particularly the physical therapy department, in order to respond to the needs and requirements during the pandemic period. Specifically, the paper aimed to answer 4 specific questions. Number 1 is what needs can be assessed in the context of delivering the Pediatric Physical Therapy Senior Clinical Internship Program during the time of pandemic. Second, what design for the program can be crafted to fulfill the learning outcomes intended for the Pediatric PT Senior Clinical Internship Program. Third, how can the design be developed and realized into a training program platform for Pediatric Physical Therapy Senior Clinical Internship? And lastly, how will the Pediatric Physical Therapy Senior Clinical Internship Training Program be implemented during the pandemic period? The study, in terms of its design, embraced the emergent qualitative document analysis. It is also referred to as emergent ethnographic content analysis. Emergent qualitative document analysis is ethnographic in its context because it gives the interaction between the researcher and the subject matter as key. It relies on the immersion of the researcher in the subject matter, conceptually informed conversation with numerous documents and examples are utilized. In this case, I am part of the pediatric clinical faculty pool, and in this case, I am immersed with the actual study itself. Emergent qualitative document analysis is emergent in nature because theoretical sampling for systematic and constant comparison is done. The study is emergent because from the beginning up to the end, it still tries to cover evolving and emerging data which will be relevant in the finalization of the conclusion. Emergent qualitative document analysis focuses on the explorer's eye, in this case the researcher, to pursue concepts, data, and other information sources that emerge in the context of the thinking and discovering process of the research. The study is qualitative because it focuses on describing and tracking discourse, including words, meanings, and themes over time. Given the design of the study, several documents were reviewed and analyzed, and the documents are actually part of the different phases of the research per se. Given the research design of the study, several documents were reviewed during the initial exploratory phase, the pilot run phase, and the emergent phase of the study. During the initial exploratory phase, collaboration meeting notes and videos were reviewed and analyzed. More so, the dry run videos and notes related to the telerehabilitation planning were also reviewed. During the pilot run phase, client satisfaction survey covering the school year of 2020 to 2021 were reviewed, together with the overall training program evaluation report for the first batch of interns who were covered during the pandemic period. More so, the Pediatric Clinical Training Program Intern Evaluation and Feedback Report were also reviewed, which was done during May of 2020. During the emergent phase of the study, the Client Satisfaction Survey and the monthly Pediatric Clinical Training Program Intern Evaluation and Feedback Reports, which was done last September, was also covered in the study. Considering the documents reviewed, 14 faculty members were considered as participants or contributors to the document during the initial exploratory phase. 9 pediatric client caregivers were considered as contributors to the document, and 56 interns from batch 2021 were considered contributors to the document for the pilot run phase, while 42 pediatric client caregivers and 15 interns from August-September batch of 2022 were considered as contributors to the documents reviewed during the emergent phase. Given the urgency to provide solutions to problems related to the delivery of the internship program, clearance was sought from the Office of the Dean in order to implement the study. The data gathered in the study are qualitative in nature, which were then interpreted into meaningful patterns and then translated into themes that were then analyzed. Considering the findings of the study for specific objective number 1, which identifies the needs and analyzes it, SWOT analysis was used. The identified strengths were faculty resourcefulness and willingness to learn and implement a new approach. Second is the support of the PT administration in telerehabilitation implementation. The third is the willingness and adaptability of interns towards new approach to learning. The weaknesses identified were knowledge and skills readiness of the faculty and the interns to engage in a new approach. Second is that no existing protocols and provisions for operations concerning telerehabilitations are present. As far as opportunities are concerned, innovation and benchmarking opportunities for PT telerehabilitation in the Philippines is identified. Second opportunity is the minimized risk for COVID-19 infection among stakeholders, particularly the faculty, the interns, the pediatric clients, and caregivers. Considering the threats, there are two major threats identified in the study. One is concerning technology, which includes the hardware and the software. Technology, inclusive of hardware and software availability and internet capability of all stakeholders, faculty, interns, pediatric clients, and caregivers, served as a threat. Second, the availability and compliance of the pediatric clients and caregivers in the program given challenging times was also identified as a threat. Considering the findings related to specific objective number 2, 3, and 4, which seeks to ask about the design, development, and implementation, the study identified 3 major themes. The first is the flexible and safe training program compliant to standards, virtual platforms that deliver the intended learning outcomes, and third, instructional processes that embrace relevant and appropriate pedagogy for the internship program. When we talk of flexible and safe training program compliant to standards, it considers the Commission on Higher Education standards for the PT program, particularly the internship program, and also memos related to flexible learning. When we consider virtual platforms, it considers all possible social media platforms and learning management systems that can aid in the implementation of the virtual program. And when we consider relevant and appropriate pedagogy, it talks about e-pedagogies that can help in the implementation of the actual training. And in this case, the study is theoretically supported by that of Mace and De Freitas and Conol in 2010 and 2004 respectively, which considers associative focus on individual learning through association and reinforcement, constructivist building on prior knowledge and task-oriented activities, situative learning through social interaction and learning in context, as well as connectivist learning in a networked environment. To conclude the study, the actual design, development, and implementation processes for the Pediatric Senior Clinical Internship Training Program was constructed. In terms of the design, the program was divided into 3 phases. Phase 1 is the preparatory training phase. Phase 2, service delivery and enhancement phase. And phase 3, the post-training or the culmination phase. The training model was also declared in the study. In your screen, the actual training program model used is presented. Here, it takes into consideration the actual competencies that are required as far as the Lasallian internship training program is concerned. Moreover, as far as the development is concerned, it was imperative that a pediatric physical therapy training manual be developed. And in this case, the manual considers all the performance indicators and competency areas based on the outcomes desired by the institution to its PT interns. Policies, standards, and guidelines were also considered in the development of the program. Here, there are two major clusters considering the actual training. It is the operations and patient management cluster and also the performance monitoring and evaluation of interns. These two subclusters under the training program fully considers both the telerehabilitation process that links the interns to the actual clients and the actual training program that links the interns to the faculty members. In the implementation of the program, the organizational structure needs to be clearly presented. And in this case, there are two arms that are needed in order for the training program to operate. And that is the operations and patients management arm and the interns performance and evaluation arm. As far as the implementation of the training program, considering virtual platforms, the Senior Clinical Pediatric Program considers the Microsoft Teams as one of its platform. Second is the use of social media, particularly Facebook and Messenger, and also the use of G Suite, particularly the option for Google Meets, in order to interact with the pediatric stakeholders. Also considered in the implementation, as far as the interns' performance is concerned, training requirements are set in the program. Moreover, the resources needed for the training were also identified. The actual training activities and instructional design for the program was also crucial. Here, it is evident that there are synchronous and asynchronous sessions in the delivery of the actual training program. Integral to the program is also the training of interns to become leaders and administrators. Because of this, the program also considers decking to the Telerehabilitation Care Coordinating Unit or TCCU. Here, they interact with clients for intake and decking and coordination with other possible services. I mentioned a while ago that the program is divided into 3 phases as far as implementation is concerned. In a nutshell, phase 1 talks about the preparatory training. Here, different requirements including the profiling of the interns and the self-evaluation of the interns are considered. During the preparatory phase, the interns are warmed up through lectures and actual video demonstrations and evidence-based practice research related to pediatrics. They are also trained to utilize documents using templates prepared for the actual training. Moving from phase 1 to phase 2, phase 2 will deal with the actual telerehabilitation process. Here, it is divided into the intake phase and the client management phase. In the intake phase, it includes the inquiry, the booking, and the physiatrist consultation and the eligibility assessment and the triaging to pediatric cluster. Once triaged to the pediatric cluster, phase 2 of the telerehabilitation process will set in, which includes the booking for history and screen, assessment, plan of care and intervention, progress reporting, follow-up consultation, and possible discharge. Phase 2 is going to engage the interns into the regular telerehabilitation sessions. Presented in front of you is a classic 8-hour session per day, considering the different sessions for the clients. This is an example of the phase 2 service delivery, wherein the interns are decked with different clients and utilizes the different rooms in pediatrics. Presented in front of you is how the actual telerehabilitation session is conducted, wherein there is a side-by-side window available for monitoring and implementation of the actual session. On one side, you will see the actual chat box where the faculty interacts with the interns. On the other side is the actual video of the interns' interaction to the clients. Here, the interns are supervised via chat and are trained to become confident and at least autonomous in their interaction with the client. Moving from phase 2 to phase 3 will talk about the post-training or the culmination phase. Here, the interns are required to answer different evaluation forms together with the faculty. So the faculty evaluates the performance of the interns using different rubrics related to behavior, related to clinical competency, the utilization of evidence-based practice, and the case presentation rubric. In phase 3 as well, interns are required to accomplish different forms of evaluations, which considers the evaluation of the training program, their peers, their own self, and also their nomination for the best intern. They are also required to reflect on the learnings that they have acquired during the actual rotation. Interns are evaluated in terms of their performance using 4 major criteria: clinical competence, evidence-based PT application, ethical and professional behavior, cultural competence, advocacy and social mobilization, and team collaboration, leadership and administration. 3 rubrics are generally used for this purpose. There are several requirements we tag as R1, R2, R3, R4, and R5 to fulfill also the completion of the actual training program. At the end of their clinical training, interns who have met the criteria are issued a certificate of completion and an individual performance report sent through their chat box. In summary, the design, development, and implementation of the Senior Pediatric Clinical Internship Program of the LaSalle Medical and Health Sciences Institute factors in the safety, compliance to standards, use of virtual platforms, and use of relevant pedagogy. Training adapts a model that considers the client management process in pediatrics as well as the learning outcomes desired by the institution for its senior interns. The program is divided into 3 phases: the preparatory training phase, service delivery and enhancement phase, and the post-training phase. 3 phases are accomplished in 2 months' time. In terms of virtual platforms, the program considers the utilization of Microsoft Teams, Facebook, Messenger, and Google Meet. At the end of the training program, the interns are evaluated using 3 major rubrics that considers the outcomes desired by the institution for the PT program. This basically ends my presentation. Thank you very much, and God bless us all.